Our session today is leveraging the lab and pharmacy to improve the health system, patient outcomes, margins, and provider satisfaction. And I'm going to introduce Trent Beach.
As we look at healthcare today, and some of you noted this, we're seeing really significant professional shortages. And as you noted, movement away from fee-for-service and dramatic technological advances. How are these trends impacting the care models today, and what do you see in the future? Dr. Wold, would you kick us off?
These trends are actually not new. There's been concern about the number of laboratorians for a long time. There is, I would say, at least optimism, at least cautious optimism about the way that we can better leverage the tools that the electronic medical record can provide to providers across the spectrum of care. Now, it's not easy, but it does require leadership to make a sort of paradigm shift in how they view both the roles of the pharmacy and the clinical laboratories. And if you make that paradigm shift, you can actually offload things from providers, primary care providers and specialists, and make it easier for them to deliver care. So the shortage is real, there's no question, but there is a solution, and it largely leverages technology, in my opinion.
Thank you. Dr. Laughman?
You know, Trent, I might just add to that along the lines of staffing and patient satisfaction, I think we should not overlook patient satisfaction as that becomes more and more important going forward. And with new technology to help scale the system, we can leverage more virtual care. And we certainly saw that in the pandemic. It accelerated greatly, even though it was in the wings. And my opinion anyway is that genie is not going to go back into the bottle, and because patients prefer it, and I think it is a way to scale staff. And the laboratory, in changing its operating model, is in a great position to support these trends out into the community and into the ambulatory setting. And I think in doing so, it can help the various team members that both Les and Anthony have described, as well as the broader care team, to really work at the top of their license and to try to eliminate some of the frustrations which are really driven by administrivia and fragmented process. And so moving toward a more integrated, streamlined delivery system can eliminate a number of frustrations. And we'll see a little bit later, some of the characteristics of the laboratory position it extremely well to play in that role.